Panic attacks are sudden and intense episodes of fear and anxiety. They can be overwhelming and debilitating, leaving those who experience them feeling helpless and terrified. We're going to delve into various aspects of panic attacks, including their causes, symptoms, and effective coping strategies to manage them. So what exactly are panic attacks? A panic attack is a sudden onset of fear or discomfort that reaches its peak within a few minutes. During a panic attack, individuals may experience a combination of physical, cognitive, and emotional symptoms. And these attacks can be terrifying, often leading to the belief that something catastrophic is happening. Here are the key features of a panic attack. Panic attacks often come on suddenly, without any apparent trigger. They're characterized by an overwhelming sense of fear or anxiety. They can cause a lot of physical symptoms, such as a rapid heart rate, shortness of breath, chest pain, sweating, trembling, and even dizziness. They also often involve racing or intrusive thoughts, a sense of impending doom, and an urge to escape. While they typically peak within 10 to 15 minutes, the symptoms can last longer, and individuals may feel drained afterwards. What's the difference between a panic attack and anxiety? So they are two distinct things. While anxiety is a prolonged state of unease and worry, panic attacks are intense, brief episodes. Understanding that difference is crucial in effectively addressing panic attacks. Panic attacks can occur for various reasons and are typically linked to heightened stress and anxiety. Common factors that may contribute to panic attacks include stress. High levels of stress can trigger panic attacks. This is because stress activates the body's fight or flight response. Anxiety disorders. Individuals with conditions like generalized anxiety disorder or panic disorder are more prone to panic attacks. In panic disorder, panic attacks are recurrent and often come without a specific trigger. Trauma. Post-traumatic experiences can contribute to panic attacks. For example, a person who has experienced a car accident might have panic attacks whilst driving. Genetics. A family history of panic attacks or anxiety may increase the risk of experiencing them. Certain medical conditions. So some medical conditions can mimic panic attack symptoms. For instance, heart problems, hypothyroidism, so an overactive thyroid gland, and low blood sugar can lead to symptoms like rapid heart rate and sweating. Substance abuse. So the use of certain substances such as caffeine, amphetamines, or illicit drugs can trigger panic attacks. And finally, hyperventilation. So overbreathing, which can be induced by stress or anxiety, can lead to symptoms that mimic a panic attack. It's essential to understand that panic attacks are not a sign of weakness or character flaws. They're a natural response to perceived threats, even if the perceived threat is not actually dangerous. Common symptoms of a panic attack. Panic attacks can manifest through a wide range of symptoms. Different individuals may experience varying combinations of these symptoms during an attack. Some of the common symptoms include a sudden increase in heart rate, and this is a hallmark of panic attacks. Individuals may feel like they can't catch their breath or are suffocating. Some people can even get chest pain or discomfort, which can range from a mild discomfort to a really severe pain. Others will profusely sweat, which is often accompanied by a cold or clammy skin, uncontrollable trembling or shivering, and others might experience things like dizziness, lightheadedness, or feeling unsteady or on the verge of fainting. An upset tummy or any kind of gastrointestinal distress or sudden temperature changes can also be experienced by people who are going through a panic attack. People can also experience a range of cognitive symptoms. So there's a fear of losing control. This is a pervasive fear of going crazy or losing control of one's thoughts. There's derealization. This is when you feel detached from your surroundings, as if everything is unreal. Depersonalization. So this is a sense of being detached from one's own body or self. A fear of dying. This is an intense belief that something catastrophic is about to happen, often leading to the fear of death. Racing thoughts. Someone can experience overwhelming and intrusive thoughts that are difficult to control. And finally, they can also have difficulty focusing or paying attention. There are also some emotional symptoms that are linked to panic attacks. For example, intense anxiety, which is an overwhelming sense of anxiety or fear. Irritability, so feeling easily annoyed or agitated. Sadness or hopelessness. So this is where you feel hopeless or sad during and after an attack. And finally, restlessness, which is a strong urge to move or escape the situation. Let's move on to coping strategies for managing panic attacks. So coping with panic attacks involves a combination of short-term techniques to alleviate immediate symptoms and long-term strategies to reduce the likelihood of future attacks. Here are some evidence-based coping strategies. We'll start with some short-term coping strategies. So the first is to recognize the attack. The first step in coping with a panic attack is to recognize it for what it is. Acknowledge that you're having a panic attack, not a life-threatening event. Number two, focus on controlling your breathing. So slow, deep breaths can help regulate your body's stress response. Inhale for a count of 4, hold for 4, and then exhale for 4. Grounding techniques can often help. So use grounding techniques to bring yourself back to the present moment. For example, name objects in the room or touch different textures to help you reconnect with reality. Positive self-talk. So remind yourself that it's just a panic attack and it will pass. Avoid negative or catastrophic thoughts. Progressive muscle relaxation is another technique that can help. So tense and release muscle groups, starting from your toes, moving upwards through your body, and this can help to reduce physical tension and discomfort. So stay put. If possible and if it's safe, stay where you are during an attack, because moving around can sometimes exacerbate the symptoms. Seek support, so talk to someone that you trust about what you're experiencing. Sharing your feelings can provide comfort and reassurance. In terms of long-term coping strategies, it's important to seek professional help. If you experience recurring panic attacks, consider consulting a mental health professional. They can help you understand the underlying causes and provide strategies for managing them. Cognitive behavioral therapy, CBT, is widely used and is an effective approach, and it's actually the first-line treatment for panic attacks. Medication. In some cases, medications such as antidepressants or anti-anxiety drugs can be prescribed to reduce the frequency and severity of panic attacks, but it's important to consult with a healthcare provider to determine the most suitable treatment plan. Lifestyle changes. So healthy lifestyle choices can play a significant role in managing panic attacks. These include regular exercise, balanced diets, adequate sleep, and stress reduction techniques like yoga and mindfulness meditation. Identify triggers. So understanding what triggers your panic attacks is key to prevention. Keep a journal to record when and where they occur, and identify patterns and common triggers. Stress management. So developing effective stress management techniques can reduce the frequency of panic attacks. This may include time management, relaxation exercises, and setting healthy boundaries. Support groups. Consider joining a support group or seeking out online communities where you can connect with others who have experienced panic attacks. Sharing your experiences and learning from others can be invaluable in these situations. Self-care. Prioritize self-care, including regular relaxation activities, hobbies, and spending time with loved ones. Panic attacks can be frightening and disruptive, but understanding their causes, symptoms, and effective coping strategies can help individuals manage them. It's essential to remember that you're not alone, and support is available. If you or someone that you know is struggling with panic attacks, please don't hesitate to seek professional help. With the right strategies and support, it's possible to regain control and reduce the impact of panic attacks on your life.